Hi Ninja Nerds, in this video today we're going to be talking about wound staging or pressure injury staging or ulcer staging depending on what verbiage you like to use, but we're going to talk about staging of a wound. So if you like this video, make sure you give it a thumbs up, comment down below, don't forget to subscribe and check out ninjanerd.org. That's where all of the notes and illustrations for every lecture that Zach and I put up here on our YouTube channels are able to help you guys follow along, learn the lectures, and hopefully get something out of them. So let's get started here when talking about wound staging. So you may have been already taught this before in nursing school and you're here for a refresher, but what we're looking at here is how does our skin that's nice and intact, it's keeping everything that's inside in and everything that's outside out, potentially has a breakdown, and then how do we tell or document what kind of stage we are in or what's going on with our skin. So to refresh a little bit, remember our skin is one of our largest organs, and it's able to help regulate our body temperature. It's helped us to protect all of our organs inside. And we have all these different layers, and I'm particularly going to use this diagram right here because it has the most. But what we're looking at here is our layer of skin, right? And we have things like the dermis or epidermis right here at the top, right? And then we have the dermis. We have our capillary bed and perfusion. Then we have our hypodermis. Then underneath that we have our subcutaneous. And then we have things underneath that like muscle, which is right here. And then we also have bone. Right. And we talked about this in our pressure injuries lecture, where when we have that constant compression or ischemia that is caused within our skin capillary bed here, we're not getting that perfusion to our skin. We have a potential to break down, right? So let's go into stage one here and talk about what's going on. So with stage one, our skin is still intact, and that's the main focus I want you to zero in on here, is that the skin is intact even though it is technically a injury or a wound. It is still intact. And why is that? Why is our skin still intact? It means that there's no break in our epidermis, but there is substantial damage slightly underneath. So what we're looking at here is this is not broken open, but we do have some swelling that can occur, right? So we maybe have some localized swelling right here. And we also have a reddened area that is non-blanchable. So if you're assessing a patient and all of a sudden they roll to the side or something and you see on their ischial tuberosity or on their hip, right, that they all of a sudden have a non-blanchable area. It's reddened, you apply some pressure, release, it's still red. That is technically a stage one injury, and we need to document that. So it's non-blanchable, the skin's still intact, it's typically only the epidermis that is affected, maybe slightly the dermis. And in darker skin tones, the non-blanchable redness can also come out as purple. So you want to keep that in mind, that it's going to be a non-blanchable discolored area on the skin. Moving into stage two. When we talk about stage two, we want to put immediately that this is partial thickness. So with partial thickness, what that means is it can go epidermis and dermis is affected, right? So when the epidermis and the dermis is affected, it means that the skin now is no longer intact. So the skin is not intact, meaning there is going to be a break within that layer of skin, within that epidermis. So it's opening up our dermis to the outside world. So what we're looking at here is a potential injury like this. Okay, so now we have a potential injury, right? We have potential swelling to the area. We have the dermis and epidermis that are potentially affected, and we're going to be looking for wounds or injuries that resemble this, right? So we're thinking, what is something that can affect the epidermis or the dermis layer of skin? So think about, let's use this color. Blisters that have now opened up, right? Abrasions. These are potentials for openings that are, or even like a shallow crater. We can put that as well, a shallow crater. these would be classified as a stage 2 pressure injury or wound because we have an opening to the epidermis and the dermis. Everything else underneath is still intact, and we are getting maybe a little bit of drainage, but nothing that is substantial. So we want to address it now before it gets worse. Because what comes next after our partial thickness is our full thickness, right? And what that means is it's going through more layers of skin. But when we're talking about full thickness, we're talking about skin loss here for stage 3. So stage 3 is only skin loss. And you'll understand that classification in a minute when we talk about stage 4. So in our full thickness skin loss, now we're looking into things that are going through the epidermis, the dermis, and then the hypodermis. So we're going to have some type of deeper crater. We're going to have an opening that's deeper into our hypodermis or our subcutaneous, right? So now we have maybe some underlying layers that we can visibly see. So this opening here, now we have some opening into our hypodermis, right? So we're going from epidermis to dermis down to the hypo. Right. So this is going to be a deeper crater. The skin is not going to be intact. I hope that is now apparent as we move from stage 2 to stage 3. The skin is not intact, and we're looking at a deeper crater. So with that deeper crater, there could be a potential for some tunneling. And we're also going to now be looking at things that may have some drainage. And with drainage also comes 2 other things that might be new. We're going to have some slough, which is that greeny, tannish, yellowy type of substance that can be right on the top or within the wound, right? And that can help or hinder actually us staging it. And we can also have eschar, which is some black that we can also see build up. And then we move into a stage 4. All right, and we talked about the layers in this diagram in particular because stage 4 is when we go into our full thickness again with tissue loss. And that's what's really important is when we talk about the tissue loss, because now that's when we're going down. This wound is so open that we are exposing bone, muscle, tendon, right? And we may also have some tunneling. What does that mean? I said it before. It's when we have these little like offshoots of the wound where bacteria likes to hide in these little pockets. So let's draw that out. We have a little tunnel here, and we have exposed bone within this area. So this is going down all the layers. Epidermis, the dermis, the hypodermis, subq, and then we'll either have muscle, bone, tendon, one or all exposed as well. So when we have this stage 4, I hope you've already gathered that the skin is not intact. Right. We have some exposed muscle, bone, tendon. We will also have that deep crater, that tunneling, and we can also have that slough and eschar as well here. So the difference between 3 and 4 is that exposure of that muscle, that bone, and that tendon. And I want you to understand that because this, you guys know that exposed bone is a very, very detrimental thing to our patient, that we don't want infection into the bone, because if it goes into the bone, then we're going to have a lot more exposure to any type of sickness as well. So let's now go into our last 2 right here, which is our deep tissue injury, and our unstageable. Deep tissue injury is when we start talking about there's a potential for injury under the skin where the skin is still intact. So now the skin is still intact, but there is an injury potentially under the skin, right? And this is when you get that patient that came in and they're maybe like, oh, she fell like 4 days ago and this bruise isn't healing. And it looks really dark and it doesn't look great. And then we find out they're on blood thinners and things like that. And those deep tissue injuries are dangerous. And they're included in this because this skin is still intact. But one little tiny shear or friction that is happening on the bed, or a little bump on the bed rail on their elbow, and all of a sudden this is open and now we have maybe a stage 3 wound here. So it's really important that when you are assessing your patient for these wounds, you're also assessing them for these deep tissue injuries as well, because those have the potential to go from 0, no breakage in the skin, right? No, the skin's still intact, to potentially a stage 3 in a matter of seconds. So I want you to keep that in mind, that the skin is still intact, but there is underlying damage maybe to the dermis or the hypodermis that is affected. And then we have the last category here, which is the unstageable, which is something that if you ever see it in real life, you're never gonna forget it. And that has to do with a potential wound that is so blocked up with maybe sloth and eschar that you can't quite see what's being exposed because there's just so much junk and stuff within it, right? We don't know what's going on. We can't quite tell what I'm looking at. So the unstageable is a category that we use when they have some type of injury that we think is pretty gnarly. And these are usually the patients that are going to have to go get this debrided because they are unable to see what's going on. And we got to see what is underneath all of that junk. So the skin is not intact. There's a substantial amount of eschar and slough. All right. So when we are assessing our patients, you want to remember what is in policy for your facility, as well as you can use your fellow nursing staff that's working with you. Also talk to wound care and have them come to bedside as well, so you can all be on the same page of what potential stage this wound is in, because it's sometimes between 2 and 3 can be very close. It really depends on the patient and the people providing care as well. But then this will also delineate the type of care that this patient will get and how we're going to focus in on keeping them safe. So I hope you got something from this video. I hope you liked it, Ninja Nerds. If you do, hit that thumbs up. And as always, until next time.